Hello, hello, hello. Okay. All right. Per usual, technical difficulties, but it's okay. We are going to get to what we have to get to today. Um, my name is Dr. Ravin Milton, and if you don't know me by now, I'm a pharmacist. I've been a pharmacist for over 20 years, and I have this episode of RX Info on the go. It's my way of giving information to people outside of the pharmacy. So, this is another episode of RX Info on the go, and today we're going to talk about chondroitin. So, do me a favor, like, tag, and share. I would appreciate it if you could like, tag, and share. Um, got me in my normal scrubs today. I'm normally not in them, but you can see I wear the scrubs, so um, if you could please like, tag, and share. And then also, if you could do me a favor and go to YouTube and hit that subscribe button. And then also go to the Facebook page, Dr. Ravin PharmD, and hit that follow button. I'd really, really appreciate it. I'm trying to get my followers up, and I need you to help me do that. So, if you are, happy with the information that I've been giving you for past over the past year, it's been over a year. Um, that would be helpful. So let me jump right into it. We are talking about chondroitin today. Last week we talked about glucosamine, which is kind of the twin that goes along with chondroitin. They both work for the same thing, which is osteoarthritis. So chondroitin sulfate is the topic at hand. It is naturally produced in the body just like glucosamine and is obtained from natural sources just such as shark and bovine cartilage, or it can be made synthetically, which is what the supplements that you take typically are synthetic, but they can also be derived from natural sources. So you can read your label to see which source it comes from. It really will tell you on the bottle where it comes from. At least it should. If it doesn't, I would be like, this may not be the brand that I need to take. So just a little tip. Um, so as I said before, it can be used for osteoarthritis, but I found something quite interesting that it can also be used during cataract surgery for cataracts. So I'm going to read this exactly as they gave it to me because I found this quite interesting. It can be used in combination with sodium hyaluronate. Sodium hyaluronate. Now, let me let you know that some pharmacists get mixed up with saying these things because can become tongue twisters when you start saying them too fast. So you have to slow it down. So we have a little bit of difficulty with these chemical names sometimes too. So anyway, it used in combination with that chemical as a medical device injected into the eye during cataract surgery. Now, I thought that was just like really interesting because I didn't think of chondroitin being used in that manner. And then also, I've never heard of it that way. I've always heard it for osteoarthritis. So that was just something new. I was quite surprised by it and pleasantly surprised at that. So osteoarthritis is the other thing that it can be used for that's been shown to be used for, and it modestly reduces osteoarthritis pain and improves function in the area, specifically the knee. There is a pharmaceutical grade of chondroitin available in other countries, not in this country, but in other countries. And that particular product has been shown to be just as effective as Celebrex in reducing pain. So, and that's the Celebrex 200 milligrams daily. So it's quite interesting that there's a pharmaceutical grade that is acceptable in other countries, but there it's not acceptable here, or found that it's not going to be marketed here in, for instance. And there is that pharmaceutical grade available in other countries, and it's actually working well for people. So just something quite interesting. It happens all the time, actually. There's some medications that are not used or not marketed in the states, but they are marketed in other countries. And I can list a few, but I'll do that later. All right, so the dose for chondroitin is typically 800 to 1200 milligrams a day in divided doses or a single dose. There are some products that are available where you can just take one tablet a day instead of taking it 3 times a day, because 3 times a day can be a little annoying and forgetful. So once a day is typically a good, thing for most people, and it is available in that way. As far as adverse effects are concerned, it is well tolerated, but you can also have the abdominal pain, bloating. You can have all of the stomach stuff going on with it, same as glucosamine, actually. Constipation, diarrhea, heartburn, and nausea. So, again, the side effects on that can be abdominal pain, bloating, constipation, diarrhea, heartburn, and nausea, which is pretty much similar to the glucosamine. Now, interactions with other medication is going to be warfarin, and that is that the effect of warfarin would be increased, which is not a good thing because we know warfarin is a blood thinner. If the effect of that is increased, it makes you bleed more, and we don't want that. So if you are on warfarin, then you are not the one that's going to take any product with chondroitin in it. Um, Oddly enough, there is an interaction with glucosamine. It does say that it lessens the absorption of glucosamine. However, there are products that are marketed with glucosamine and chondroitin together. Typically, when something like that happens, the amounts of the glucosamine and the chondroitin are offset to account for the lack of absorption of one, so that the numbers would be the about the right numbers. Typically that's what would happen in a perfect world. So, um, but I still would suggest taking the two together, because the two together in those products, Osteo, Bioflex, those off-brand products that are labeled with the glucosamine and chondroitin, they have been helpful for people. So don't be discouraged by the fact that just because it says on paper that it does lessen the effect, is actually doing something for people. Health conditions. So asthma is exacerbated by glucosamine. Pretty much, if you have asthma, you want to stay, I'm sorry, glucosamine, chondroitin. Well, actually, glucosamine too, because we covered that last week. But we're talking about chondroitin. So if you are on anything for asthma, if you have been diagnosed with asthma, the chondroitin could possibly make your asthma worse. So you want to stay away from this product. The other product, or the other thing that is a concern, is that there's some information out there, nothing that is finalized, but there is some information floating around that the chondroitin may increase the risk of prostate cancer. Now, I couldn't find anything that was sound when doing the research for this. However, if you want to do the research or ask your doctors about it, as far as men, ask your doctor if that's something that you should be concerned about. Especially if someone in your family has a history of prostate cancer, then I would definitely say just ask. It doesn't hurt to ask. Um, I, again, didn't find like an overabundance of information concerning that. It was just something that was listed. So I typically try to put all information out there so that you don't have to typically do the research yourself. But on this particular one, you would have to talk to your physician and make that call together if if you are worried about a risk of prostate cancer. That is actually all there is to chondroitin. It is pretty sweet and simple. just like glucosamine is one of those that are kind of like really direct. There's not a lot of indications that they have seen it work for. There are things that they're testing it for, doing studies. And typically, when these studies are being done, they're being done by people who manufacture the product. So they are trying to do studies to see if it'll work in different areas, if it'll work for diabetes or cholesterol or anything like that. But everything that is substantial, all of substantial evidence leads to the chondroitin helping with osteoarthritis and helping with cataracts and cataract surgery. So we, don't really say that something can work for it until we've actually seen it. That's what's called evidence-based medicine. We can try things out and have trial runs, but when you start seeing the numbers add up to where it's actually working for someone, and those numbers are real numbers and not, just fake data, I guess you would say, but or assumed data. I think that's the word I'm looking for. Assumed data, like actually happening, not theoretical. Then that's when we say that something works for something. Um, so that's going to be it. It's very short, very sweet. I didn't take up too much of your lunchtime today. And I hope that you got a little something out of this. If you are the person that has osteoarthritis in the knee, I actually do suggest you trying it. I actually started taking it myself recently just because I have some issues with my knees. Um, and I'm trying to have the healthiest knees I can possibly have. So I started taking the glucosamine chondroitin combination, and I'm taking one tablet a day. It's the triple strength, I believe it is, that I take once a day, and I just started taking it. So um, I can actually come back and tell y'all in about a month or so if I'm feeling any type of relief, especially because I kind of work out a lot now, and these needs are really being affected by it. So I want to be able to tell you things to help you out, just as I experience them, I get to help you out with that. So do me a favor, like, text, share. As always, go to that YouTube page and subscribe. Go to my Facebook page and hit that follow button and share it with your friends. There might be some information in here that you needed. Um, if there is something that you would like me to cover, go ahead and drop it in the comments, or you can go ahead and DM me and I will respond as soon as I get a chance, um, because I do still work full time. So thank you so much for tuning in, and I will see you guys next week. I'm not sure what the topic's going to be, but I always have something for you, something I haven't covered before. Sometimes it's something that I have covered, and I just need to recircle, circle back on it. So, y'all have a good day, and I hope you enjoy your day. If you are off today, enjoy it. Rest, 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 rest.